So welcome back from lunch. We have the next most interesting session. This will be on shared value health insurance ecosystem. We have Maya Surmama, who is the Chief Executive Officer of the Vitality Group in the US. Unfortunately, she could not be here with us on site, but she is doing this live from her office in the US. So Maya, over to you.
Thank you, and good afternoon, everyone. We are seeing three major trends that are shaking up insurance industry, and I think two of them I can certainly say it's probably shaking up any industry. Technology is really transforming our lives today, not let alone this industry. And then there's more and more pressure on the organizations to actually look beyond their bottom lines. So look to delivering value and then actually creating a bigger value for the society. And then lastly, the nature of risk. We have a very different understanding of risk, and the nature of risk is also changing from this static to being more changeable, modifiable, and it's largely driven by the behavior, so behavior factors that are driving the risk largely. And this three trends are forming really our core model that we've deployed across all our businesses, our shared value model. To explain that simply, it's really about aligning the incentives in a specific ecosystem across all the stakeholders to motivate them to change the behavior, which in turn delivers the value. And then some of that value is channeled back into the incentives, and then in essence creating this continuous cycle of the value generation in the specific ecosystem. Everything that we do is really powered by data. Data is a foundation for all the decisions and everything that we deploy. And we are pulling data and then leveraging data from a variety of sources, a really multi-dimensional data view, and then finding some interesting correlations across the different data sets. So we merge your health data with insurance data, with your behavioral data, experience data, how you spend on your credit card, your retail data, how you make your purchases, how you make your investment decisions, and so on. And then this view really gives us a comprehensive understanding. And we've been quite fortunate to, over the last 3 decades, to collect the most comprehensive data set on the behavior in general and the risk. And then powered by this view and this intelligence, we have evolved our understanding of risk. So starting from the static, your traditional static view, where the factors don't really change, so you can't really change the risk with the static view of age and gender. We've added multiple layers onto that. So firstly, your health view, looking at your health record and then adding your health profile to that view, then adding your behavior profile. So what you do today, what you're going to do in the future. And then lastly, our ability to actually intervene through the targeted behavior change actions to predict what your risk curve is going to look like in the future. So this multidimensional view of risk allows us to then engage the members and really incentivizing them and then deploy the interventions to modify this risk. And then we're seeing some really strong results across the disease. So if I look at the health context specifically, we see much better health outcomes, and across your major chronic conditions, so behavior-linked chronic conditions, we see up to 50% reduction in some cases of the claims cost linked to those conditions. And similarly in the hospital, so we're seeing lower hospital admissions for the highly engaged members. You can see 28% reduction in hospital admissions and then over 50% reduction in the hospital stays if someone ends up in the hospital. So massive healthcare savings and then obviously the massive improvements to someone's health. And just to walk you through this model in more detail in the healthcare and the health insurance specifically. So we start with incentivizing the members, and it's really a 4 basic behaviors that we look at, which is your physical activity or lack of physical activity, the healthy diet or unhealthy diet, smoking and excessive alcohol consumption. And then we deploy rewards to incentivize members to change and adopt the healthier lifestyle. And then this immediate rewards is something that really engages the people, but obviously there are longer term rewards of better health. Unfortunately, logically, one shouldn't need to get a reward to do something that will make them healthy, but we are not always rational as human beings. So we put on disproportionately larger value onto the rewards and something that we get today to something that's more longer term. So those immediate rewards are driving the behavior change. What that means for the insurers as a payer in this, as an important stakeholder in the ecosystem, it means obviously better health of their population, of the members that they cover, and also results in a reduction of the claims costs. And across the major chronic conditions, which are major contributor to death and an illness worldwide, and the healthcare costs in general, like diabetes and the cardiovascular and the lung disease, we're seeing up to 50% in diabetes case, 53% reduction of the claims costs linked to this disease for the engaged members. So it definitely delivers major difference in terms of the health and then in terms of the healthcare costs linked to that. We're also seeing an attraction of better health or a better risk, your younger population, healthier population, and the similarly retention of the healthier population. So it's overall it's a massive improvement of the risk profile for the payer. In return, so the value, so besides the immediate rewards, the values that we can give back to the members is lower premiums. And then the other side of this equation is a healthcare provider and a very important part of the ecosystem. And similarly, we incentivize healthcare providers to actually drive better health outcomes, different from your traditional model of fee-for-service, when doctors do something and they just get paid for the transaction. This is really, they get incentives to actually drive the better outcomes. So they are focused on the health outcomes rather than on transactional volumes. And largely, I think the cycles and obviously creates the healthier population and delivers value to the society. And then we're seeing for a health insurance, if you take your high level, the value chain for a health insurance or a life insurance for that matter, it really has an impact across the value chain. So in terms of attracting and retaining members and attracting and retaining healthier members, and in terms of the pricing, so in the markets where you are allowed to do the dynamic pricing, you can get really sophisticated and apply different pricing models based on your understanding and the management of the risk, and then really make a difference in engagement and the behavior change and the care management enablement. So driving the better utilization of the benefits, driving prevention, driving better healthcare outcomes, and ultimately reducing the healthcare cost. And then across our two businesses in two very different health insurance markets in South Africa and UK, we are seeing, just to summarize, we are seeing really the impact of this across this value chain, and in terms of having a younger members compared to our peers, healthier members compared to our peers. We can see the impact of the behavior change, and we can actually see the result that we can engage people and then really change their behavior positively, and then obviously in return gets the lower healthcare expenditure. And this model is actually quite transferable and applicable into other verticals. I already spoke about health insurance and the life insurance, but if you look at the long-term savings, so retirement products, there are three behaviors. So again, the three behaviors that you can motivate to change that will result in a better risk profile and then better settlement for your retirement. Similarly, in the motor insurance, there are 5 behaviors that result in your fatal accidents, the risk on the roads. So if you actually change those 5 behaviors, you can end up with a better risk profile for a motor insurer. And similarly in banking, just incentivizing better financial decisions. So a model is equally applicable across the industries. And then what we are seeing today, I think it's obviously, I think I'm stating the obvious, but the healthcare costs are growing exponentially. But unfortunately, post-COVID, we're also seeing some undesirable results of reduced physical activity. So this remote setting, people are spending more time at their desks. They are less active, moving less. And they're also increasing the mental health challenges. So we had a problem already to start with, especially increasing the disease burden, and then plus added to that is actually a post-COVID, we are seeing some negative impact in terms of the physical activity and the mental health challenges. And that's why it's more important now than ever to actually make a difference and then change that health profile and the risk profile. So to do that, you really need to understand your population and understand how to intervene in the different segments of the population and what will work best. And the key ingredient of really making a difference here is engaging people, because you can deploy fantastic programs, but if people don't actually do things and they don't engage with the program, you can't really deliver any results. So we use our Vitality behavior change, behavior science-based engine to deliver this. Sorry, am I still on? Because I've lost the screen. Okay. Apologies for that. I hope you can hear me. So we're using this Vitality behavior change engine to really engage people to deliver the result and deliver ROI from these programs. And we can see as an example, in general, post-COVID, we see the reduction in preventative screening across our population. But if you split the population into the members that are engaged in Vitality program, we are actually seeing a better results for them than for unengaged. So unengaged reduction in the preventative screening is significantly more for the unengaged lives. And just a simple example of how this works in terms of engagement and the changing behavior. And if you want people to do something, I think a very basic is to make it as simple as possible and remove any friction. Because if someone starts doing something and then there are some obstacles and then they have to actually it's so difficult to get around, they will drop it even if they have a huge desire to do it. So it's really, I think, just I'll give you an example from our active rewards programs that we've deployed in partnership with Apple. You get the watch, you don't have to pay for it, or there is a small activation fee that you pay. You link your watch, so you don't need to do anything special. You would link your watch as you would normally with your app. And you get your personalized objectives for the week. And then weekly, as you get engaged, you actually don't have to pay for your watch. However, if you don't meet your weekly objectives, there is a small fee that you have to pay back as a premium for your watch. And then I think there's an additional factor that's working here really strongly is the loss aversion. So naturally, I think it actually engages people more when they had something and they are about to lose it. So we are seeing a massive engagement in this program. Overall, I think across all our markets, we're seeing 34% increase. But if you look at your high-risk population, so it's also engagement where it matters and where it delivers the highest value, we are seeing up to 200% in some of the markets increase in the physical activity for the high-risk population. And then there's a trigger effect of this. So what we are seeing is that as people engage in the physical activity and they start exercising, they actually then go to the next thing that they do better, like they actually start eating better, they do more preventative screenings and so on. So this engagement in one activity that changes your mindset actually triggers engagement in other healthy activities. And then similarly, we are seeing actually it translates into digital engagement. So we are seeing a massive increase in the digitally active users across our population, the population that's actually engaged in the program. So someone that started with a physical activity actually is more engaged in other things, and then as well as more digitally engaged. And then just an interesting fact, the physical impact of the physical activity goes beyond the chronic condition. We've seen a massive reduction in risk with COVID for our physically active members. You can see up to 45% reduction in some cases. And just bringing it back to this ecosystem that we've created for the members. Once again, it's all based on data. So at the core of it, it's the data that we collect from the variety of sources. And then we're really looking at collecting as much data as possible about an individual to create the full view of that individual. So it's a self-captured data joined with the insurance data, your clinical data, some of the device data. We are adding more and more devices. So from your normal wearable fitness devices to medical devices, point of care devices, remote monitoring devices. And then powered with this data, we derive the powerful insights and then an intelligence that then delivers the interventions across the care and the health and the care continuum. So starting with the healthy population and the healthy segment, and then really driving and promoting the healthy behavior and the healthy habits and keeping healthy people healthy and then preventing any risks there. Moving on to now condition management, so of people with the single condition or a multiple condition when they need help with the medication tracking and medication adherence, looking at gaps in care, deploying various care pathways. And the lastly is most involved layer where there is a combination of the digital and then human interventions that's for your more multiple chronic condition members and your population that's more ill. And then really the power of this is to create one digital door into the healthcare ecosystem, that when an individual enters this through the door, they have seamless access to anything that they need across their health and their care continuum. Obviously, it's powered, I think, and that's core to this is the integration, and then we've been investing quite a bit into driving the integration and interoperability across the ecosystem, and that's also plugging in the third-party solutions. So it's not all created by us. We really facilitate the integration of the multiple digital and the humans' physical solutions. And then the core of it is to make it as seamless as possible for the member or a patient navigating this ecosystem. It's easier said than done. I think there are multiple challenges in terms of the data interoperability, but also, I think it's the privacy is posing an additional layer of challenge to this. So trying to balance between privacy requirements and then really passing on this context across this ecosystem. But it's definitely something that's absolutely required and necessary because the healthcare ecosystem is highly fragmented. And then many of the waste that exists in the healthcare expenditure today is actually linked to this fragmentation and linked to poor care coordination, and then really patients being lost about what to do when they need help and so on. And this is really, this has been our core purpose from right from the beginning, and we stay true to this core purpose, and that this is how we deliver on this core purpose of making people healthier and enhancing and protecting their lives. Thank you.
All right. Thank you, Maya. Thank you for that enriching. Right. So we have the audience clapping. I'm not sure you're able to hear them.
I can't hear anything, no.
Okay, we do have some questions on the chat, and maybe, you know, I will get the first one out for you. So will Discovery become a digital orchestrator for medical services? For instance, will you offer digital prescription and medical services you charge for?
So we are already a digital orchestrator, and then we already offer the orchestration of the e-prescriptions and medicine delivery linked to it. It's not a service that we actually charge for, it's a service that we provide to our members.
Great. We have one more question which we can take. Healthcare is an evolving space, and how do you keep your ecosystem relevant and growing actively?
Yeah, that's a very good question and a very interesting challenge. So I think it's a continuous enhancement. It's been set up. I think there's been a lot of focus on interoperability and integration. And it's really the ecosystem is there to plug in any emerging solutions as quickly and as seamlessly as possible into the ecosystem. So it's continuous scanning of the environment and a continuous addition and enhancement of the ecosystem. And that's something that you will be continuously playing a catch-up game. But it's the architecture, it was built with that in mind to start, that it's not going to be static, it should evolve. And in fact, there's been a 10-year journey for us, and it's an incremental journey. So it's you start from as simple things and then you evolve this.
Great. Any other questions from the audience? We have 1 more minute with Maya on schedule, so happy to take one more question if you have any. Okay, I think we are good. Maya, thank you once again for joining us remote, but still on live. Thank you very much for the sharing as well.
Thank you. Thanks for having me.